Stephen Pennington, and we'll be talking about the cranial nerves today. So, to begin with, the cranial nerves are, of course, in your cranial area. So, we're going to go to a model from Dr. Forsman's, and if you haven't had this class yet or plan on taking it, I would definitely suggest using that website. It has been an absolute godsend. But anyway, I digress. So up here, you can't exactly see it, but it starts olfactory nerve, which is up in your brain. And this is your brain stem. So it goes pons, midbrain, medulla oblongata. And as for the nerves, you have your optic nerve, your oculomotor nerve, your trochlear nerve, your trigeminal nerve, your abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, and your hypoglossal nerve. So that makes up your 12 cranial nerves, except the one you can't really see. So this is a mnemonic that was used in class for the name of the cranial nerves. OOO, they traveled and found Voldemort guarding very special hollows. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, and spinal accessory nerve. And then your hypoglossal, which that's supposed to be down there. So the mnemonic for the components of cranial nerves, some of them carry just sensory, some of them carry motor, some of them carry both, just like any other nerve that you have of the body. So some say marry money, but my brother says big brains matter most. And the mnemonic that was on this previous slide, I highly suggest if you have a test in this to put them side by side and you can match them up to their components. And if it asks, is optic, sensory, motor, or both? You can say, oh, okay, optic, some, and then boom, optic, sensory. Now, for the functions of the cranial nerves, we are going to start out with the olfactory nerve, which it leaves via the cribriform plate of the ethmoid bone and synapses in your nasal cavity, and its function is smell, as presented on the PowerPoint. And the important thing about it is it doesn't originate in the brainstem, and it leaves in the olfactory bulb, and its only component is sensory information. And as for the component of your second nerve, your optic nerve, it's going to do your vision, and it leads via that optic chiasm and synapses in the retina of the eye. And it's only sensory information as well. Now, your oculomotor nerve is going to leave via your interpendicular fossa and inferior to cerebral peduncles, and it synapses in the muscles of the eye, which it synapses in all of them but two, which the two is the superior oblique and your lateral rectus, which we'll talk about the nerves that does them in a minute. So this includes your superior rectus muscle, which moves your eye up, your inferior rectus muscle, which moves it down, your medial rectus muscle, which moves it inward, and your inferior oblique muscle, which it moves it in and down, and your levator palpebrae muscle, which retracts and elevates your eyelid. So it also constricts your pupil and focuses your lens. So another nerve of the eye is going to be your trochlear nerve, and it leads posterior to come around superior to the pons, and it synapses at your superior oblique muscle, which is one of those we was talking about that your oculomotor doesn't hit. And its function is to move the eye, which it would abduct your eye, move it outward. And its component is motor, of course. And now trigeminal. It leads laterally to the pons but superior to the cerebellum. It synapses at three different parts: ophthalmic, maxillary, and mandibular. And this is going to be your muscles of chewing, and as well as it feels the skin on your forehead. And it includes both motor and sensory components. And as for your sixth nerve, it's going to be your abducens nerve, which is going to abduct your eye and hits the lateral rectus muscle of your eye, which is one of those that neither your oculomotor or your trochlear hit. And it leaves below the pons and enters into your superior orbital fissure and then onto your lateral rectus of the eye. And as for your facial nerve, that's going to move your face. It creates saliva. When you cry, this is going to be the nerve that does it. When you taste something, and also sensation of your ear. And it leaves at the medulla oblongata, and it's the most superior nerve. Also, your internal auditory meatus. And its function, or it contains both motor and sensory components. Now onto your vestibulocochlear nerve, and it's going to leave laterally to your olives that are located in your medulla, as well as your internal auditory meatus. And it's going to synapse at your cochlear and your vestibular ganglion. So its function is going to be hearing and balance of the body, and that's just going to be one of those that's just sensory nerves. And moving on to your glossopharyngeal nerve, and it's also going to leave medially or at the medulla and laterally to the olive, and it'll travel through your jugular foramen and skull. And it snaps in three different places, which include your external ear, your tongue, and your pharynx. And it is going to do the swallowing of the body, as well as salivates, your taste, it monitors your sinus and your sensation around your ear. Now for another weird one, the vagus nerve, it's going to leave as well meet in your medulla, lateral to your olive, and go through the jugular foramen. It's going to go to your ear, your epiglottis, your pharynx, thoracic, and abdominal viscera. So this is a nerve that's going to travel all the way down to your thoracic cavity. I've been told that when you're nervous or something's bothering you, that's why this is a nerve that makes your stomach kind of feel upset somewhat. And so moving on to your spinal accessory nerve, this is going to leave at your spinal cord and travel up the foramen magnum to your jugular foramen. And it's going to synapse at your traps, and it's going to turn your head and lift your shoulders. And its component is motor. And as for the 12th cranial nerve, your hypoglossal, this is going to leave medially to your olive that's located in your medulla, as well as your hypoglossal canal. It's going to go to your tongue, which moves your tongue, and its component is only motor. And that's all I have. Thank you.